a lot of the things I push back on are related to these kind of harmful messages. Maybe a really good one is telling people that, maybe it's convincing people that certain postures are bad or that asymmetry in the body is bad. This is one that I end up talking a lot about. Like humans, we just naturally have asymmetry. We have a dominant hand and a non-dominant hand. Like there's a dominant leg usually and a non-dominant leg. There is a lot of asymmetry in the human body. Somebody was watching one of my Instagram posts the other day and they said, "Oh, your right shoulder is lower than your left shoulder," kind of trying to make it out like it's a negative thing. And that's very common. Usually the dominant arm, the shoulder hangs lower on that side. It's just it's not something to worry about. But if I didn't know that and someone said that to me, I might worry about it.
Hi, I'm Lauren Parsons.
And I'm Andy Jackson, and this is the All Well Co podcast.
Dive deep with us as leading experts share their unique perspectives on topics such as recovery, sleep, movement, and the latest innovations in the space.
So Tom, welcome to the All Well podcast.
Thank you very much for having me.
Yeah, pleasure to have you here. You're really well known for your work in treating musculoskeletal pain and movement disorders, as well as you're the driving force behind Rehab Science, which we'll get into in a minute. Could you just share us what initially drew you into this field and, what motivates you in your line of work?
Yeah, a lot of it for me, I think getting into this field of work, getting into physical therapy was really based around being an athlete. When I was in high school, I was a martial artist and a gymnast and had knee surgery when I was 16. I was actually born with something called a bipartite patella where my kneecap was in two pieces. And it was just kind of this small little piece that was off from the main part of my kneecap, but it was enough that when I would land from jumping and things like that, it would cause quite a bit of knee pain. And so I had that piece of bone removed. And then at that time, it was back in the day when we weren't mobilizing people as quickly after surgery, and they put me in a straight knee brace for 6 weeks. And because of that, I developed a really severe contraction. I couldn't bend my knee past 90 degrees. And ended up being sent to physical therapy. My quads were, of course, really atrophied. I hadn't used my leg really in 6 weeks. And that was my first introduction to using exercise as a way to kind of heal the body and rehab the body. Prior to that, I thought about it all just for performance, muscle mass and strength and power, how, being able to jump higher, things like that. So that was really kind of my first, I think, being introduced to physical therapy in high school, put it on my radar. And then in college, I looked at a lot of different professions, but I was really just, my degree was in exercise science in undergraduate and my undergraduate years. And there were I looked at different options, all kind of healthcare related, but physical therapy was just the closest fit to me in terms of being able to really that main interest in exercise science and nutrition. And then kind of that previous experience of being in physical therapy, it was just the most natural fit.
So Tom, which martial art? Was it Kung Fu?
I did Taekwondo. I was really heavy into sport Taekwondo, which is the sparring. You wear like a hogu, they call it, around your chest and a headgear. And, it became an Olympic sport the year I graduated from high school. So I, for a while, really thought I would just train in sport Taekwondo and see how far I could go with it. And maybe even open a Taekwondo school. I taught, I was in high school, so I was teaching like other younger high schoolers or elementary school kids. I was really I didn't know it, but I was really into teaching and education. So I thought I'd just open a Taekwondo school and skip college, but ended up deciding to give college a 1-year try. And then I became obsessed with anatomy and physiology.
That's awesome. For our listeners who might not be familiar, could you explain in layman's terms what rehab science is, what pain science is, and then someone like yourself, what a rehab scientist, as you call it, does?
Yeah, it's a great question. Sometimes it's hard when you've been in something for so long to distill it down. But rehab science it's sort of like the umbrella term it's this idea. It would have all these professions that people commonly interact with: physical therapy, chiropractic, even some of the movement practitioners like Pilates and yoga, if they're anyone interacting with someone who has pain or has an injury, a muscle strain, they've sprained their ankle, they have back pain, sciatica, tennis elbow, anyone who's helping someone with a condition like that would technically kind of be underneath this rehab science umbrella. So it's really looking at problems in the human movement system. The idea of studying human movement is kinesiology, and technically people who are in kind of the rehab science field, especially physical therapy, they technically study pathokinesiology, which just means dysfunctional human movement. So you're looking at abnormal human movement, and then what interventions can be used to get the person back closer to kind of normal human movement, understanding there is kind of a wide range of normal human movement, but you can look at some things like walking, like human gait. The walking pattern has been studied for years and years, and that is there's kind of a normal around that, and you can get sort of a benchmark you can get people back to.
Yeah, that makes a lot of sense. Is there a philosophy or a methodology that you tend to stick to that maybe is outside of the norm?
I don't think so. Really the methodology that I follow I often tell people is really just, I think, just sort of standard orthopedic physical therapy. I have my board certification in orthopedic physical therapy, and most orthopedic physical therapists, there are different approaches, small kind of changes within kind of orthopedics and sports medicine, but the methodology that I use to look at things, I really think is what the majority of orthopedic physical therapists probably do. I might have a little bit more of a spin towards that pain science you were talking about, which is kind of looking at just the complexity of pain. Unfortunately, a lot of practitioners, whether they're physical therapists or chiropractors, have a very, what's called a postural, structural, biomechanical view of pain. So it's really blaming all pain on posture, anatomy, and biomechanics. And I was very much that way when I was a new grad. But the longer I've been in it and studied pain, which is the number one symptom anyone's coming to physical therapy for, is pain. And so there are a lot of people that get better if you look at pain from kind of a posture, anatomy, biomechanics only perspective, but there are a lot of people who don't. And that's when you have to start thinking about, especially those chronic pain individuals. Those individuals often have a much more complex situation going on. And then you have to look at this pain science area and understanding how emotions and thoughts and memories and culture and all these things factor into the pain experience.
What's quite interesting to me about that is that I love the sort of calling yourself a rehab scientist rather than just calling yourself a PT. We're very much into calling people like yourselves, instead of calling you ambassadors or influencers on social media, we like to call you professional advocates because we believe you're professionals. So I think that's a really interesting spin on some of the tradition. So taking that a little bit further, you've obviously done quite a bit in outpatient orthopedics. I even read that you've done a stint with sports rehab with Cirque du Soleil. Could you highlight a couple of kind of memorable cases from these experiences that really stand out to you?
Yeah, Cirque du Soleil was such an interesting job to have. I really enjoyed the time there, and really probably some of the most fascinating cases because that organization has so many different types of individuals coming into it. A lot of them former Olympians. We had a lot of like Juilliard level kind of dancers on the show that I was on. Every show is a little different, but I would say Cirque du Soleil was a neat place for kind of seeing how your upbringing and how culture influenced how you looked at pain and injury. And one of the cases that always stands out to me there was that we had a group of 4 contortionists on our show, and one of them had back pain, and she grew up in Russia, and pain was sort of viewed as a weakness. So she would never come to see us. Every athlete could come to physio. They could sign up anytime and come in every day and get worked on. But she would never sign up, and we just hear from other people that her back was really bothering her. And so it really took a lot of kind of education and kind of convincing to get her to come in and let us work on her. And then, I think once she was exposed to it in kind of small baby steps, she opened up to it, and it ended up being really helpful to her. But that was, I think it stands out to me as one of these prime examples of how you grow up, how pain is framed culturally, or maybe how your parents frame it, or your peers or whatever, and how that can influence the way we look at it. And obviously, we don't think of pain as a weakness. It's really your body's way of alerting you to threat and keeping you safe. So we don't want to we often view pain as this negative thing, but having pain actually most of the time is really useful. There are some people who are born without feeling pain, and they usually don't live that long. You really need that warning system. So I always love cases like that where you kind of get a chance to reframe pain for people and reframe it in sort of a more positive light.
I think that's what Lauren does for me. I think I'm her biggest pain, and occasionally I give her a little bit of light to do things.
It's the good with the bad.
So, Cirque du Soleil, tu parles français?
Let's see. Un peu.
Un petit peu. Okay.
I took French in high school and I don't remember anything. And now I live in Southern California, so I'm always around the native Spanish speakers. So my brain is so mixed up now between Spanish and French. And of course, they're similar, but I'm always messing things up.
So obviously you're getting challenges all the time. And obviously you've just taken us through how you navigated that story. Are there any really funny ones that come to light that you've had and experienced?
Yeah, funny stories. Nobody's asked me that before.
I'm Scottish. Sorry, I asked these weird things.
Yeah, no, it's good. I'm sure there's a lot of them. I mean, I naturally like to joke around with people, but I'm not sure I can think of a funny story off the top of my head. It's always the challenging ones. There's so many cases where there's been so many times in being a PT that I have had people come in that I thought there's no way this is going to work out positively, or our personalities just aren't going to match up. Because of course, when people are in pain, oftentimes they're really grumpy and down. They're kind of depressed. They're often kind of irritable. And so there are so many situations that stand out in my head of times when that first evaluation, the person's so irritable that I'm just thinking, this is not going to go well. And then sometimes those become your best people if you just kind of stick with it and can remind yourself that, it's not fun to have pain. And, but it definitely, I'm naturally a pretty patient person, but I'll have these inner dialogues of, oh man, this isn't going to work out. And then it is amazing how many of those situations end up becoming the patients that you talk to for years after they leave and you become friends with. But I'd have to think a little bit to maybe come up with a funny story.
No problem. I know I put you on the spot. So, okay, so let's just transition a little bit. So Rehab Science is known for offering both tailor-made rehab programs and virtual consultations. Can you just walk us through the benefits of each approach, please?
Yes, for sure. That's a good question. I think as I've been in the kind of online education space longer, the interesting thing that I've seen is that when I was a new clinician, I would have said every person needs to come in for a evaluation in person with a physical therapist so that they can create a very specific tailored program for them. And that's the only way you're really going to get better. That's what I would have thought as a new clinician. I think in the 7 years that I've been online, putting content out, often sharing, okay, here's a condition like tennis elbow, and here are 3 or 4 exercises you can do for this. The interesting thing that I've seen is that often these sort of cookie cutter sort of programs help a lot of people, and so something like a program that's already been created that isn't personalized to you, I do think there's a place in many cases where you can start something like that and get better. And maybe you, if it is a situation where you don't get fully better, then I think there is a lot of value in that kind of personalized consultation, whether it's virtual or in person with someone, because the value there is that if somebody comes in to see me in the clinic in person, or I'm talking to them virtually, I'm hearing their story, I'm hearing about their symptoms. I can take them through different movements. If they're in person, I can palpate and kind of test things. It just allows you to be really specific to what are their unique symptoms and what aggravates their symptoms. And then you really can give them, often these days, I'll just give people 1 to 3 exercises, 1 to 3 movements that are really specific to their unique case. But again, a lot of times if you go get a kind of general program, it might have 6 or 8 exercises. And I think if you can go into that knowing this is a general program and I'm going to test these movements and see which ones help me the most, you'll end up finding the same process where you'll probably distill down to 1 to 3 movements that are the most helpful for you, and you kind of move forward. So it might be a little less efficient, but I think both can have their place.
Yeah. In your book, you deliver protocols that aim to strengthen the body, reduce pain, and prevent future injuries, kind of like you were just talking through, actually. Could you give us an example of one of these maybe popular protocols and discuss the science behind why it's effective?
Yeah, it is very similar to what I was just talking about. The book, essentially what I did, I've been a PT for 17 years, and after a while of evaluating and treating people who have these different pain issues and injuries, you realize that most humans encounter the same 15 to 20 musculoskeletal disorders. And I included 50 in the book. There's 30 programs in there, all by body region. So I included a few more. Some are fringe. Like a kneecap dislocation is only like 2% of the population, but I included that in because it has similar symptoms to something like a meniscus tear or a ligament tear in the knee. So some of these could kind of group in with others, but there are really probably 15 to 20 conditions most people are going to face. So you could look at something like plantar fasciitis. Like a lot of people are going to have plantar fasciitis at some point in their lifetime. And the programs in the book, oftentimes when we treat people, we go through, as orthopedic PTs, we'll kind of go through a process of first looking at how can we kind of calm the pain down that somebody's come in with, calm that sensitivity. And so my programs are all broken into 3 phases, which sort of mirror what we would do in physical therapy. So that first phase is kind of looking at how can we calm pain down, which is what any PT is really going to do. The person's coming in, really most patients, that's their primary goal, is to get rid of pain. So you're doing that first just so you can move on to helping them with their function. And so that first phase is kind of getting pain calmed down. Phase 2 is the part that really where PTs probably are more concerned, looking at addressing impairments. So does the person have a range of motion / mobility deficit? Do they have a deficit in neuromuscular control? Do they have deficits in strength? So it's really attacking all those impairments so that they can function well in life. And then phase 3 focuses on rebuilding capacity for people, which is really revolves around resistance or strength training. Any good physical therapy program really should focus on resistance training as you get to the kind of the middle and late stages. We just have so much evidence looking at strength training and its ability to improve capacity of your musculoskeletal system, which means you're less likely to have something become injured, to be strained or tear when you put stress on it again in life.
Yeah. I want to talk about a specific, more increasingly common issue, which is tech neck. And I know you've talked a lot about that. Can you walk through the issues you see with it? But then I don't want to misrepresent you. You mentioned something to the effect of it might not be an issue if. Can you just go into detail on that?
Yeah, tech neck. I know this is something that's talked quite a bit about. It's kind of the idea of all of us looking at our phones, especially kind of looking down and holding our head in sort of our neck in sort of that flex position with our head down, and maybe people experiencing discomfort in that position. And while there are people out there who get neck pain from being in that position for too long, I think the danger with it, which is we've seen with other kind of postures in the body, is that we don't want to demonize. You don't necessarily want to say that looking down and having your neck inflection is a bad posture. It's just that really any posture is negative if you're there for too long. And this is the same for sitting, right? It's like sitting with your head forward, sitting with your shoulders rounded, just sitting for a long period. Just being static in any posture will tend to cause symptoms and discomfort for people at some point. I think our musculoskeletal system, our nervous system really likes movement, and that's what nourishes it and promotes blood flow. And I think it just helps keep our nervous system healthy and all the other tissues in our body. And so tech neck to me is one of those examples where it's not necessarily that posture of having your head forward and holding it is necessarily bad for your neck, because you'll see people kind of promote that you've got this 15-pound head that's hanging forward and that's damaging to your neck and the discs in your neck. I don't agree with that. I think our musculoskeletal system is really resilient, and if you put stress on it in small doses, it will adapt, just like it does with strength training. If you go to the gym and you put 5 pounds on each weight to the barbell, all of your tissues adapt. If you hang your head forward, your posterior neck muscles are going to adapt and get stronger. If you're looking down at your phone all the time, if you took somebody who never had a device and then you gave them a device and measured their muscle mass and their posterior neck muscles over a 6 month, a year period, I bet you their neck muscles get bigger. Because if they're hanging their head down like that, your body's just going to adapt. So to me, it's not that it's damaging to the neck. I think sometimes when people talk about it that way, or whether it's an article or something on social media, they make the musculoskeletal system out to be fragile, and then people feel worried about hurting their musculoskeletal system. To me, it's more just that if you keep yourself in any static position, you're more likely to end up developing pain, not necessarily because you're damaging something, but just because you aren't moving enough.
That's quite fascinating for me, because if you think about lots of sports like American football or wrestling or even playing chess or things like that, that's the position that you're in, yet these are some of the best athletes in the world.
Exactly.
Quite interesting.
Yep.
Taking, a current trend. So everything I hear at the moment is that you've got to jump in every cold lake. You've got to get out there, and ice is the key to recovery and pain relief. And it seems to be a whole industry on itself. I'd love to just hear your thoughts on the whole ice revolution. Are you an advocate for it? Do you have reservations? What's your thoughts on ice, in essence?
I'm not super excited about it. I think there can be a place for some of those kind of thermal stressors. I do think that the majority of life is quite comfortable, and so I do think there can be a place, whether it's psychological or maybe the physical stimulation of it, of putting ourselves through these stressors. I mean, that's essentially what exercise is nowadays, right? Like if you go running or go lift weights, you're essentially just trying to put mechanical stress on your system that we probably encountered just more naturally when we were hunter-gatherers. And I think the same is true of heating and air conditioning units in our houses. We're just always comfortable. So, I grew up in Montana where it snows and is below zero for multiple weeks throughout the year. I just was encountering cold thermal stress all the time, just going to school or work or whatever. So I think when it comes to pain and injury, I looked back at this research when I was writing the book, and there is some pushback on ice recently for soft tissue injuries because of the idea that it can potentially delay the healing process. It slows the migration of macrophages into injured tissue, which macrophages are a cell, are a component of the immune system. They come in and clean up damaged tissue. And so there has been some research showing that macrophages get to your injured tissue more slowly if you ice it, just because you're causing vasoconstriction and blood flow slows to the area. On the flip side, if you have pain, there is research showing that ice can help decrease pain. So by kind of slowing nerve impulses. So I think I rarely do I want to throw something out or say it works for everyone. So I think it's kind of there's some nuance and there's a case by case basis. If somebody just has pain and they don't have a soft tissue injury, like a strain or a sprain or something where a tissue is clearly injured, I will often tell people, if you want to experiment with ice or heat for pain relief, that's okay with me. Heat also has research for pain relief. So I probably more often these days lean towards heat just because of being able to promote blood flow and reduce pain at the same time. But, I think there are interesting applications potentially for cold exposure. Maybe it is that pain side of things. Maybe, you hear sometimes talking about reducing inflammation, maybe the potential of cryotherapy and whole body water immersion of reducing inflammation. And I think there's also the whole side of what it might do just to kind of shocking your nervous system. Maybe if you have anxiety or depression, maybe psychological benefits that are outside the physical body.
That's interesting. That kind of explains back in the 70s and 80s when I was playing soccer and playing football from where I come from, we used to put this heat stuff on our legs that used to burn our legs, etc., all the time. And I just thought it because it was cold in Scotland and it made us feel better. But what you're saying is there were some benefits from that heat.
Yeah, exactly. Yeah, there's some good research out there for whether it's like a heat pad, something like that, and being able to, I forget the exact physiological mechanism, but the way it stimulates some of the receptors in the tissue, it can help kind of turn down that pain a little bit.
Interesting. So obviously, access to world-renowned professionals like yourselves isn't always within everyone's reach. And we're going to have some listeners here who will be dealing with pain and injuries on their own. Are there any sort of self-treatment methods that you recommend beyond what you've said already?
I think that, I was just talking about this the other day, and I think sometimes for people just having kind of a general blueprint or framework for thinking about pain and injury can be really helpful. That way, if you're dealing with something now or something comes up in the future, it doesn't cause as much sort of anxiety and worry. Sometimes just having a plan, kind of a general plan, really helps just not feel so anxious about being injured. And to me, a lot of it is kind of thinking about, if people kind of think about those three kind of phases that we would work through in physical therapy, first kind of reduce pain, then work on correcting any impairments or sort of deficits, and then build strength. And I think when you're thinking about reducing pain, things like self-massage techniques are often really helpful. So mobilizations like with a ball or a foam roller, kind of just massaging the area. It kind of, people will know, like when you do that and it's the right thing, it kind of creates a hurts good kind of feeling. When maybe it's plantar fasciitis and you're rolling the bottom of your foot with a ball or something. And that often does have this kind of, it's like, you're doing something positive. And I think that can apply to a lot of things. Maybe it's foam rolling your back or foam rolling your calf or something, or using a ball to massage some of your, kind of up in your neck and scapular muscles. It kind of helps reduce tension and pain. So I think a lot of times in that phase one, it's when you're thinking about reducing pain, it's soft tissue mobilization. So that some tool, it could be kind of mobility exercises, like easy mobility exercises where you're just gently kind of moving the area that's painful and just sort of stimulating it in that way. And then when you get to the next phase, say you've kind of got your pain knocked down a little bit, then you really want to start looking at primarily range of motion. Like, do you have full range of motion? A lot of times when people have pain or an injury, they protect things and joints can get stiff. And so I think that's what I would tell most people to focus on next, is just, can I move my joint through all the movements that are possible and through full range of motion? And there are lots of resources. I cover this often. What are the movements my shoulder moves through and what's full range of motion? Or just compare to your other side. If you've got just one injured limb, compare to the other side. And then last, I think, is just try to build strength. Like, develop a program, progress gradually, work on building strength in all planes of motion. If you kind of go through that process of like, I'm just going to calm the pain down, I'm not going to totally rest for too long. Sometimes maybe 1 to 3 days of rest is okay, but after that I need to get moving, and that might mean soft tissue mobilizations, easy mobility exercises. I'm just going to calm the pain down and get moving. Then I'm really going to work on making sure I have full range of motion, and then last I'm going to strengthen the area gradually. I think if people just have that plan, that's what I would say for most pain and injuries.
Yeah, that makes a lot of sense. Is there a common myth that you would like to debunk, or a truth that you think everyone needs to hear?
Oh man, there's so many. I think
you dealt with ice already, so that was interesting.
Yeah, there's a lot of there's this whole idea of like, there's the placebo, where certain messages can reduce pain because you believe something positive is happening. And a lot of interventions, a big part of them are placebo, right? Where like you just believe it's going to help you. The other side is the nocebo, where you hear a harmful message and it ends up hurting you in some way. And sometimes those nocebic messages can make people more fearful, more worried about injury. It can even increase pain in some cases. So a lot of the things that I like to debunk are nocebic messages that I see online. It's a big reason why I got started on social media, because I had patients coming in who had seen practitioners who, unfortunately, sometimes practitioners will, unintentionally or intentionally spread these kind of harmful messages to keep people coming back for their services. Sort of like the idea that, okay, maybe somebody has back pain and they go in, and even just the language of, oh, you threw your back out, you need to come here for this treatment on a weekly basis so I can put your back in alignment, and that's how we're going to get rid of this pain. Versus so much of the research on rehab is really most supportive of exercise and movement strategies that empower people, that build self-efficacy. Those are the things that have the best long-term evidence, and those are things that you want to teach people how to do, because it allows them to go home and self-manage on their own and not have to be dependent on the practitioner. There is a place for things like manual therapy, adjustments, different things where you're working on someone. My residency was in manual therapy. I see a lot of value in putting my hands on people, but not convincing them that they have to always keep coming back for that. The goal should be to just use that. That to me is phase one. Those are, like I was talking about before, that's a phase one treatment. It's helping reduce pain. And then after that, everything I'm teaching them are things that they can do on their own so that they can learn to self-manage their own injury and pain issues. And so a lot of the things I push back on are related to these kind of harmful messages. Maybe a really good one is telling people that, maybe it's convincing people that certain postures are bad or that asymmetry in the body is bad. This is one that I end up talking a lot about. Like humans, we just naturally have asymmetry. We have a right hand, we have a dominant hand and a non-dominant hand. Like there's a dominant leg usually and a non-dominant leg. There is a lot of asymmetry in the human body. Somebody was watching one of my Instagram posts the other day and they said, "Oh, your right shoulder is lower than your left shoulder," kind of trying to make it out like it's a negative thing. And that's very common. Usually the dominant arm, the shoulder hangs lower on that side. It's just it's not something to worry about. But if I didn't know that and someone said that to me, I might worry about it. I might worry, oh, I am asymmetrical and that shoulder's down. I bet you that's going to cause problems. Or maybe just so happens that I have shoulder pain and then I believe that that's the reason for my shoulder pain. And so a lot of the information that I push back on is related actually to kind of posture and structure and these old biomedical myths that all pain is really related to posture and structure. I push back on that a lot. For sure, that can be associated with some people's pain, structure, anatomy, posture. In some cases, that can be associated with someone's pain, but way too often people believe it's like the only cause for their pain.
Yeah, that makes a lot of sense. It would assume rigidity, right? It would assume we move like robots and there's not various planes of motion and that we're not fluid. So that makes a lot of sense. You mentioned social media. Andy and I have watched your social media just completely take off.
Absolutely,
which is so impressive. Kudos to you.
Thank you.
How did you get started and what do you think aids to your success?
Yeah, it's been so neat to see it grow. Honestly, I just got on. I was teaching full time when I started my Instagram account, which was late 2016, and I really was doing it to try and push back on all these narratives that were frustrating to me. So it was never meant to be a business. I was just doing it as a hobby and to try and put positive things out there. And I think a lot of the reason it grew, there are so many factors in anything becoming successful in life. I think some of it was right place, right time. I was one of the first physical therapists probably putting out a lot of physical therapy content back then. But I think I also came into it, I'd been a PT for 10 years at that point, so I was familiar with a lot of the patterns in physical therapy, a lot of the common questions and issues. And so I think those things coming together, the fact that I'd had some good experience, I was just looking to put out content to really just serve people and help people and not some secondary gain of making money from it or something. And then having the bandwidth, I was in a job that wasn't a typical kind of 40 hours really full time. I was teaching full time, which there's gaps, a university, when you go to university, there's just gaps between classes. I think that allowed me to have time to post every day. And I was kind of in the research. I was teaching biomechanics and pain science. So I was being filled with great content besides my physical therapy background to put into posts. And I really think that kind of the combination of how all those things work together. I had no strategy in the beginning. I wasn't going into it trying to grow a social media account. I was just literally just trying to put out content because I was frustrated with what patients would tell me. So I think that when I look back on it, I think that kind of recipe helped it grow. And I think to this day, now that I think more about what I'm doing a little more intentionally, I think so much of what has made the account successful is just continuing to show up and provide value. I'm posting every day, and I've been doing that for 7 years. Wow. And I think covering things that actually are relatable to people, which is, if you're a brand new grad, it's hard to know what most patients are having problems with, but after a while you do kind of see those common patterns, then you can address those in posts. And on a visual platform like Instagram or YouTube, physical therapy rehab is a great place for those platforms because everything we do is movement based, which is great for a visual platform.
Yeah. You before we started recording, we talked about your YouTube growth a little bit. If you were to give someone advice as to how they would start their channel, what would that be?
Yeah, I think what I've noticed, these platforms are all looking at each other and trying to figure out how to keep people on their platform. And so at the end of the day, it's all about that. How can you keep someone engaged with your content, not swiping away from it? And the the thing that really helped me grow so quickly on YouTube was the shorts area, which TikTok kind of started this kind of vertical, kind of quick content. And I think for someone who might be looking to, and then Instagram had Reels, and then YouTube started bringing in shorts, and that type of content really can help grow a channel quickly. I think the one potential downside of it is that there is some thought that maybe the short attention span with that short content, people don't watch longer form, more meaningful content as much. So it is a tricky line to watch, to kind of walk. But for me, I've seen it be mostly positive, where that type of short content kind of hooks people in and they get interested in a topic. So like I'll put a lot of my content that does really well are the manual therapy videos. So I just had one, just a simple upper trapezius massage video where I'm working on Kirsten that's at over 50 million views. So that video hooks people and they are interested in what's going on in the video, how to work on that potential muscle. It's an area that a lot of people have, tender points and pain. And so I think they see that, and then it brings a lot of subscribers over to my channel, and then they watch the longer form videos too. So I think for someone who's growing, that might be that maybe that's a strategy to look at if you're brand new. Provide value, like right off the bat, it's the quality of the content. Like you just have to have quality content first and foremost that helps people. Make sure you don't have, horrible audio and video. And then after that, maybe use short form content to really hook people and build your following or subscriber base. And I think we put those together, those factors, and ultimately just stay consistent. YouTube's kind of a nice platform because you don't have to do it quite as much as Instagram. I just put 2 things up a week. So it's a little more manageable if you're a person who works full time. Sometimes doing the daily post of Instagram, if you're not a full-time content creator, it can feel pretty overwhelming. But something like YouTube, you could put up 2 pieces of content a week, and maybe that's a little more manageable.
So Tom, just on that basis, is there one secret rehab science thing you do on social media that you wouldn't want anyone else to know that I'm going to ask you now to tell everyone about? Is there anything that you just do and you went, wow, that one thing, if everyone else knew that, they would really succeed?
No, there's nothing secret. It literally, I think if people saw the systems and processes behind the scenes, I do everything from my phone pretty much. And videoing, editing, pretty much everything is from my phone. I'm not doing anything secret. It honestly is just being consistent and sticking with it and providing and creating content that it solves problems. Like you just have to be consistent and solve problems. It's not anything fancy. I honestly, there's really nothing secretive about anything I do. I mean, of course, if you watched me go through all my steps, I think somebody who's new to it would think, oh, that's a lot of steps. There's a lot of little things that I go through, but none of them, they're all little pieces that form the bigger thing. None of them are like a super secret hack or something. They all work together to kind of create momentum and move the whole thing forward.
I love that.
It's great that you're offering that advice, because one of the things we're trying to do here in Allwellco is create a platform that professionals help professionals. We help each other to do that. And I think what I heard from you there, if I was a young professional moving into this world, is stay consistent, get some short content out there, and make sure that you're regular with your message, and don't jump from ice to hot to this or whatever. Find your principles and just stick with them. Have I got that right?
Totally. I think you really have to. The nice thing that when you're a professional, whatever background you have, when you have a specific skill set, it allows you to niche down really quickly. And I think it is important to niche down. I have met people over the years who are trying to start channels, and they are kind of a jack of all trades and they don't know where to start, and they have a hard time growing because they jump around a lot. So I think the nice thing for me is that I was so obsessed with rehab and physical therapy, it forced me to niche down instantly. And then I'm even farther deeper into just orthopedic PT. So everything I focus on is only that topic. And so I think once you kind of really focus and just find that specific topic that you're going to work on, then you just stay consistent with it and answer and solve problems for people, and things will just naturally grow. As long as all these things are a marathon. YouTube didn't really start moving until my third year. So I think too many people think, oh, this is just going to take off right away. They have this idea. You see videos like, you do hear case stories like that, where I just saw a 15-year-old that got 1 million subscribers in 2 months. So he really did. He took advantage of shorts, and he did a lot of research and figured out tactics to go viral. Now there are cases, usually cases like that, people are using other people's material and they're creating really viral clips. It's not they're only doing it to go viral. That doesn't really apply to me or someone maybe in the rehab space, because I'm focusing on this type of content that probably is less likely to go viral. So some of those tactics don't always apply, but I think it really is just figuring out staying focused on your thing, doing it consistently, and solving problems. And if you put those three together and you think about it as a marathon, you stick with it. If you're thinking about it as a marathon, anybody who starts with you, the majority will quit and fade out over time. So even when I look at when I started Instagram to now, there's only a handful of people that are from the beginning that are still there.
Yeah, no, it's interesting because we're in the same place, really. We're an organization that wants to promote and support other professionals. That's our niche, and the aim is to show people's strength. We want to give people's perspective. You probably noticed today we're not giving you any views of what we think, because we think it's about perspective. It's about what you think, and a lot of people on podcasts want to tell you their views. We are not really interested in that. We want people to hear about you and what you're doing and be that sort of niche. So I think that's great advice. Well, so taking a little bit further then, so you've got all these successful projects, you've got all this wonderful expansion going on under your belt. What's next on the horizon for Rehab Science?
The big things for me, I'm really excited. I was just telling you before we started, I launched my podcast. We're kind of launching, you guys are a little bit ahead of me, but launching the Rehab Science podcast. I just had my first episode come out. The second one comes out tomorrow. And so I'm really excited to focus on building that over the next few years. And then, some people are familiar with my Rehab Science book. If you're on video, it's behind my head right here. But that kind of big textbook-sized book for all the common pain issues and injuries. In October, I will have 7 smaller books coming out that are for each body region. They're a soft cover. Sometimes people just have a shoulder issue. They don't want the big book, or they're traveling and they want something easier, so they just want the shoulder programs or just the low back programs or ankle programs. So we're essentially going to take kind of chapters from the big book and make them their own small kind of soft cover books. If you've ever seen the Treat Your Own series, the McKinsey books, there's a series on Amazon, Treat Your Own Neck, Treat Your Own Shoulder. It's kind of an updated version of that in a way. It's like a very specific programs for each body region in a smaller book. So I'm excited about that. Those are kind of the big things on my horizon right now.
So just taking that as a thought. So if there are any other aspiring authors out there, what tips would you give them to write their own book? How would they do it? How would they go about it?
Well, I do think it actually is similar to a lot of the things we're talking about here, that if you want to get into the world of writing, a lot of it is, I think, finding a way to kind of look at being consistent with bite-sized chunks, finding time. And, and I learned this, I have to give credit where credit is due. I learned this kind of secondhand because my book, I had a co-author, Glenn Cordoza, and Glenn did the Supple Leopard book with Kelly Starrett. He did Brett Contreras' Glute Lab book. Glenn is an amazing writer, and he does that full time. And what I saw with Glenn is that he's really disciplined with every day just sitting down and writing no matter what. Glenn has a black belt in jiu-jitsu. He's very disciplined naturally. Well, he's trained it, and he's learned that and trained that. I think a lot of it from martial arts, it's just who he is, but he sits down and writes every day. And I think I've seen that he can really, when you do that and you stay consistent with it and you put in enough time, all of a sudden you create, when we have a 500-page book. So I think in watching Glenn, it really solidified that concept to me of consistent kind of daily bite-sized chunks of work. And when you stack that together over many days, all of a sudden you have something that's really comprehensive and large just by putting those. And I hear a lot of writers talk about this, that even when you don't feel like writing, just try to write a few sentences, just every day kind of chip away at it. And that's something I definitely learned from Glenn. Glenn did a lot of the heavy lifting. The first 10 chapters of the book are a lot of text. And Glenn, we would kind of interview, we'd do like a Zoom interview, and I would teach kind of the content, and then it would go to a transcriptionist, and then he did it, and then he'd have to rewrite it in kind of my words. So those 10 chapters were a lot. The whole back 2/3 of the book are all the programs, and a lot of that were me writing those, but the same principle still applied, because there's 50 different conditions in there. Each condition has a description, signs and symptoms, aggravating factors, prognosis, a treatment strategy. I had to go through and write each of those. And so it's the same idea, that writing 50 programs and all that information for each one is very daunting when you think about it up front. But if it was just each day, I would just think about, I'm just today going to cover labral tears in the shoulder. I'm just going to try to get the description down, the signs and symptoms, just these kind of little elements. And then every day just doing that, eventually you have hundreds of pages of programs.
So this has been fascinating, and I think you've given lots of tips for people who want to be as successful as you in this field, and thank you very much for that. As we wrap up the conversation, I'd just like to touch on something that's close to our podcast heart. You've probably realized that our thing is about strength, kindness, and perspective. So you've given us a ton of stuff on strength, a ton of stuff on your perspective. But is there someone there that you want to show kindness to? Is there someone out there that embodies that value? You'd like to give them a shout out just to show kindness to them?
Well, I would say Glenn, who I was just talking about, my co-author. So much of what I'm doing right now, for so long, I was only on social media platforms and working towards this goal of putting helpful content out there. But Glenn really reached out to me in February 2021. And I think back to just the journey I've been on, how grateful I am to him for reaching out and to have the opportunity to work with someone who's has so much experience and such skill in putting books together. If I had tried to do this on my own, it would not have turned out to be the same product that it is. Glenn knew all that experience. If we should put an illustration here, or do a call out box, or let's reword. There would be times where we'd scrap whole chapters and he'd want to rewrite them because he didn't think they were good enough. I am so grateful to that opportunity, getting to know him and to work with him on something like this, because I had tried at points in life previously to go to Starbucks and try to start writing a book, but it's a very challenging endeavor. It's very intimidating to think about creating something like that. And so the journey that's come from this, the book's been out almost a year. I've had so much fun. It's been so cool to see. Every day I get tagged by somebody somewhere in the world. The book just got translated to Polish. And so to see it in different languages now and around the world, people will tag me in Tanzania or Ukraine or somewhere that they have the book. And it's such a more comprehensive, my social media was helping people with the book as just a much more comprehensive resource, and to see it out there in places in the world where somebody might not have great access to rehab, or it's too expensive, or the educational system is is outdated compared to more developed countries. It's so neat to see a resource like that out there. So I literally am just so grateful to Glenn and meeting him and getting to work together on that project.
I think you just summarized something that I believe in too. This podcast wouldn't exist if it wasn't for Lauren. And when you find that partner and you find that person and that thing, it doesn't have to be about you. And I think social media and the way the world is now, you think it has to be about you and what you're content. But actually, once you find a partner and somebody talented, it's amazing what you can do together. So I'm glad you found your Lauren and Glenn, and it's working for you. Thank you very much, Tom, today. This has been really, really interesting. And we wish you luck with your podcast and everything that you do. And of course, here at All Well Co, we're here to support you all the way.
Yeah. I'm really excited to release this episode. Thank you, Tom.
Oh, thanks for having me on. Like I said, I've been emailing and DMing with you guys for years. So, so fun to actually kind of hear a voice, to actually get to know you more.
For real.
I love what you're doing. Thank you for having me on.
Just quickly before you sign off, don't forget to visit network.allwellco.com and join our professional network. You'll get to enjoy exclusive benefits from brands we love and have access to a community where learning and professional development are always at the forefront of everything we do.